Chapter 5 Qualification and Interpretation. The assessor holds a manual of application, a format where all the items are recorded, a format of qualification of the individual items and for subscale, and a format of consolidated records. A point for every approved item is given. To qualify an item as passed, it is necessary to see the behavior on the child. A few items can be asked to the parents. Information is registered in a pre-established format. An individual format for every evaluation can be used, or the same format for all the evaluations realized throughout the year. Adds all the approved items of every subscale and then the total score is obtained. Modification for premature babies. After more than 20 years of experience in the application of this scale with the premature children, the psychologists of the Kangaroo Mother Care Program in Bogotá have successfully implemented some modifications to be known. The evaluation begins with the items corresponding to an age of 6 months prior to the current age of the child, since the development of a premature baby is asymmetric and can present delay of different severity. Corrected age is in use always. The experience of the experts from the Kangaroo Mother Care Program of Bogotá has led them to add to the qualification the label of R. That means that the child did not achieve the level weighted to approve the item, but he or she is in the process of doing it. Following the expert's opinion, the original kit changes for common and very similar toys that measures the same processes than the original toys. This is done in order to facilitate the modeling and generalization of the tasks performed in a family environment. It is performed with the parent's presence and immediate feedback is given. Interpretation. Assessment of the child with this test allows us to obtain age of overall development, age of development in a specific area, a profile for the child's development and general quotient development. Total raw scores obtained by the child in the assessment become scale scores, that is to say, become developmental age. For such purpose, the chart 20 of the manual is used, where there are to the left side the possible total gross scores, and to the right of the same one the corresponding age of development. To obtain the ages of development of every subscale, we use the chart 19 of the manual and the same previous procedure is done. It is considered to be normal until a month of lag in the development. To obtain the profile of development of the child, a graph of bars is elaborated with the scores of the scale, of the areas, and of the total of the Griffiths. This graph allows to easily identify the areas that are deficient and those that are excellent. To obtain the quotient of general development, we apply the standard formula that for such an effect exists. That is to say, age of general development over corrected age by 100. And then it is compared with the criteria of normality standard. It is very important to use the exact age of the child, months, and percentage of the month. It is obtained by adding to the month of age fulfilled the number of days that pass of the exact date according with the table. All the scores are recorded and the information of identification of the child is registered on the sheet of consolidated records. In addition, the results found in the evaluation are annotated in the clinical history of the child, as well as the actions suggested and/or taken and the moment of the next control. Feedback. This part of the evaluation is based on the knowledge on infant development and the skill and tact of the assessor when communicating with the parents. Once finished the evaluation, the assessor must say the following things to the parents. How is the child's development in regards of his or her group of age? Which are the deficient areas and which are the good ones? To communicate the necessary actions that need to be taken to overcome the deficiencies. Always consider the possible variables that are influencing in the problematic that appear in the picture. Teach the parents stimulation exercises for each area. They may be performed at home and thus promote the development of your child. These exercises should be according to the age and level of development of the child and the cultural and economic resources of the parents.